Hello everyone, I'm Dr. Dan Brees, the Vice President for Physician Services and Chief Medical Officer for Memorial Health System.
I am Dr. Watzkier, one of the infectious disease doctors at Memorial Health System.
Today we wanted to talk to you all a little bit about what Memorial Health System is doing to deal with the current pandemic of COVID-19. Back in December of 2019, we were first alerted to the COVID-19 virus. We started meeting and preparing for what our response would be at a healthcare system during that time. If patients were ever to present, we wanted to be prepared for how we would deal with them and how would we keep our community and our patients safe, as well as our employees. Since that time, especially in the last several weeks, as COVID-19 has spread globally, we have heightened our alert and our awareness here in our health system. We've instituted an incident level command center, which involves multiple members from our medical staff, as well as our infection control department, infectious disease, physician, as well as administration. We meet daily and sometimes more than once a day to make sure that we are all up to date with the current local, state, and national guidelines that are given and how to treat this disease and to prevent this disease. Currently, as we keep up to date with all of the information that we receive, we have changed many policies that have been that are instituted inside of our health system. One such policy to keep our employees and our patients safe is to limit our visitation in this health system. For example, we now are instituting a no visitor policy unless there are exceptions for minors, end-of-life care, or for those that are receiving a procedure which would be required. Another example of how we're keeping our patients safe is that we use the most up-to-date cleaning products to keep our facility clean. We've invested in the latest technology to include the Xenex robot, which helps provide most up-to-date cleaning environment for our patients to receive their care. We expect in the next 24 to 48 hours to stand up what we call the assessment center. Patients that present with flu-like symptoms or feel like they have flu-like symptoms and have discussed this with their primary care doctor or another provider in our organization will be asked to go to this center to be evaluated and to possibly be tested. One of the things that we want to emphasize to all of the patients in the community and our employees is that we are here for you 24/7. Should you feel ill, should you have any symptoms that we will be discussing later in this video, we encourage you to call your primary care doctor's office, or you could use our nurse call line, which is available 24/7. It is staffed by registered nurse 24/7, 365 days a year. Another and final option would be to utilize our Memorial Care Now app. This is a telemedicine service that you can download from our website. It's an app that will be used on your phone or another electronic device where you will be connected to one of our providers who are on call 24/7, 365 days a year. They will be able to walk you through the current recommendations for your illness and direct you to the right access point to receive care in our health system. Now Dr. Watzkier will be discussing with you all how to prevent this illness and keep yourself safe and those safe around you.
So what we want to get to the community, given that this is a rapidly and emerging situation, we have seen an increased number of cases every day. And we want to give you the recommendations and based on the current information that we have. So most of the cases, patients are presented with respiratory symptoms, and we just want to let you know what would be the best way to prevent for you to get ill. So if you're presenting with any type of respiratory symptoms, including cough or shortness of breath, you should stay home. If you're at work and you're not feeling well, you should go home. We would advise you to call ahead, either your primary doctor or using our nurse line, so we can advise you at that time and guide you in your care. Some of the other things that we want to emphasize at this point is that based on the current recommendation, the best way for you to prevent illness is to try to avoid to be in contact with people who are ill. Currently, there is no vaccine for this illness, but the best way for you to prevent for getting in contact with the virus would be to wash your hands with water and soap. If water or soap is not available, use a hand sanitizer. The next thing that we would encourage at this time, based on the current recommendations, practice social distancing, which means staying away from other people within 6 feet. If you're presenting with any symptoms like a fever, cough, shortness of breath, running nose, or body aches, make sure to get in contact with your primary care provider. Otherwise, call our nurse triage line so we can guide you in your care.
So again, we thank you for your time today, but I want to re-emphasize a couple of points. We want you to know that Memorial Health System is here for you. We are providing safe care each and every day. Through this time of the pandemic of COVID-19, you will still need to receive health care. And we want to assure you that we will continue to provide your health care and meet all of your needs in a safe environment. I also want to re-emphasize that should you feel ill or have any flu-like symptoms that would be indicative of possibly having COVID-19, we want you to call your primary care physician's office. You can call the 24-hour nurse line, which is staffed 24 hours a day, 365 days a year by a registered nurse, or feel free to use our Memorial Care Now app, which again you can download on our website. Thank you again for your time today. Feel free to reach out for us for any of your healthcare needs or questions. We will get through this together.